Hey, everybody, welcome again to Each on the News. We've got Danielle Morrison. She's a National Practice Manager, Healthcare IT Services at a large MSP called All Covered. And we got our story. It's an amazing story, apparently, and we're going to find out exactly what goes on in the healthcare industry. Danielle, welcome, first of all. How are you doing?
Good, thank you, thank you. Well, great to be here. Thank
Very good.
you.
I'm joined with Paulo, my colleague, and we're gonna gang up
Hi,
on
everyone.
Danielle and ask her questions and see if we can get to the bottom of what's happening in the healthcare industry. Out of the gate, though, before we just get started here, give me a bit of an overview. Like, tell me about All Covered. What do you guys do as a general organization, and then we'll talk more about specifically healthcare.
So All Covered is the IT division of Konica Minolta. Konica Minolta is a large global company. We are their IT division, and within that, we are an MSP and an MSSP. So we have both the sort of the aspect of the technology and the security offered. We have a national presence, and within our overall landscape, we have verticals. I represent the healthcare vertical. And we provide solutions and services to organizations throughout the US.
I'm just gonna say it's huge. So let's just go on from there.
Yeah.
So uh so then I guess the healthcare, I mean, right now with what's happening in the Middle East, so we're all kind of concerned because it's no longer just ransoms. It's just seek and destroy type thing, and destruction seems to be the name of the game. Um, how do you see it right now? What are you concerned about? First of all, what keeps you awake at night when you look at the healthcare market?
When I think of where healthcare sits in around its security posture, the industry itself was a little slow to adopt certain technologies to begin with. And then that's sort of left behind making IT decisions strategic. So they're sometimes they're much more reactive at times, leaving gaps in security that are just getting bigger and bigger because the threat is getting daily much more impending. There's so much, and healthcare is one of the critical industries. So to keep that in mind, and at the end of it is patients. So it's a little different than certain other industries. That's not consumers; it's a patient. So I think overall, as the global threat landscapes continues to sort of get worse, it impacts healthcare in a different manner that's almost more exponential to criticality because because of the services provided across the industry. So not just in hospitals, but across the industry that need to be kept secure. Our data needs to be kept protected because it's highly valuable. So I just think it's not a great environment. There's some things really need to change to help make improvements in the industry.
100%. Paulo, what do you how
Yeah,
how should we be steered?
Danielle, I was just thinking, like because we Julie and I we deal with a lot of MSPs that are in healthcare, and the thing that strikes me is that it all is connected and it's all interconnected, and I think the biggest worry, as I see, and I wanted to ask you about that, is that the attack surface is no longer confined to the hospital network, and it's spiraling into like vendors that supply critical infrastructure devices, the individual endpoint devices, and it's just sort of like targeting the broader healthcare ecosystem. Is that the biggest worry right now? And how do you, as an MSP, come to grips with that to try and like solve this massive problem?
So yeah, so the attack surface in healthcare continues to grow. And it's not just also reaching out to the vendors and all the other pieces of supply chain that support keeping daily operations going. There's also increasing aspects around supporting all the medical devices that tie
Mm-hmm.
into daily operations too, because they are a attack surface as well. Um, so as an MSP, our approach is to first work with the organizations to coach them to find out what do you have within your environment. Sometimes there's almost just not a full clarity of
Mm-hmm.
what's in to understand then the full risk. If you don't necessarily know where all your potential threats lie, the potential for,
Yeah, yeah.
vulnerabilities, you're just letting them in the front door because you don't even know it was unlocked.
Right,
Um,
right.
and so that's sort of one of the things that we encourage to sit down and have a consultative approach to talk with potential customers and with existing customers to sort of have that understanding of where they see their risks, and then also maybe do a further analysis to point out that you also have some risks over here too that maybe you weren't aware of.
Mm.
Kind of a discovery.
Yeah.
Daniel,
Yes.
Yeah.
what do you see? Where are the problems happening that you guys are seeing on the front lines? Is it from devices? Is it from doctors trying to remote control stuff? Where are the problems that you're seeing the most of, or is it all?
Some of the biggest that we're still seeing is around some of the more, not basic, but almost business email compromise.
Mm,
Certain that's still around phishing attacks. Like all those sort of the you know the psychological side of things that they can still get people to click
mm,
on
yeah.
something within an email or open an attachment. Um, the other aspects too is in around almost incomplete security that you put in place sort of maybe the best or attempt at best which you can afford because across the industry healthcare is no one size fits all.
Mm,
Yeah.
So there's budgets that that vary significantly from organization to organization. So you might have in place some what at the time were top of mind or really top dollar pieces of, you know, your malware aspect, anti-malware, things like that. But that's old school. Now you need to be moving to things like MEDR. But you have to have conversations, you have to have the skill sets, the persons to work with, and the capability to, when you're looking around those solutions, not only to be able to deploy them, but manage them and have the experts to manage them. And that's where some organizations are having that gap that they think they have in place strong technologies, but that was 3 years ago what was best fit, and it no longer is. It's this disconnect in education.
Danielle, when I was looking up all covered, I found this really interesting. I mean, you're based in New Jersey, you're a top performing MSP, but the company has pinpointed three areas of focus. Number one, outdated systems, cybersecurity threats that are obviously ever expanding, which we mentioned in the previous question, but also hard to use tools that are holding back all these organizations. Why did you find it important to build a strategy around these three focuses?
So one of the aspects, well, I'm going to start with the hard to sort of navigate, manage the tool aspect.
Sure.
So some organizations approach things that they want their MSP or even themselves to deploy their tools and then manage them. But there's skill set limitations around that to have an expert that it's ongoing expert. So that's where, and there's a lot of tools out there that again sometimes fit a budget, a conscious organization, but once it's deployed, it's clunky, it's awkward.
Yeah.
So that's where it's not the best suited. Cybersecurity is next just because of globally, cybersecurity is it's an issue. It's one of the largest GDPs out there. There's things now, ransomware as a service. That's not just in healthcare.
Yeah.
It's huge. So it
Yeah.
has to be a top of mind issue.
what about that? The attack on Striker. What do you know about that? What could you tell us about that?
So I know with that attack, in the end, that was within Stryker's internal business environment. But anytime you have an organization of that size that has so many services and solutions and even hardware, striker beds, things like that within
Yeah.
within an organization,
Yeah.
then there's always concerns around will it get to my patient data? And I mean, Stryker did a very good job, I think, of communicating to say this is an internal, but they still had to bring their systems down.
Mm.
And that's a disruption to service then whenever that happens, potentially to the organizations that their products and services support. So it's concerning. It's always sort of I do think at least Stryker, compared to some organizations, did communicate to the best of their ability. But sometimes there's limitations too of once an organization is breached what federal agencies recommend in communication. Sometimes they're told to press pause, which can make a difference that can lead to some mistrust because there's not as much transparency around what's going on. But I see you can see both sides of sort of why they do that is so they can do a thorough investigation without bias. But yeah, so the striker was attack was it's a new big because it's going back to that third party aspect. It's not necessarily it wasn't a hospital system or a
Yeah.
payer. It was a third party. Yep.
Just seems overwhelming. But
Yeah.
yeah, Paulo.
Yeah, no, one of the things about the healthcare industry that I think a lot of people don't know because I think they would believe that it's a large enterprise, right? But in fact, it's built around tons of small to mid-size enterprise, clinics, basically, all across the United States. And security breaches. I think the latest research has it at over 6 billion. I'm sure it's grown by the time I finish reading that paper. But as an MSP, and I know this may be an unfair question to ask you, Danielle, but do you feel it's your duty to put pressure on the security vendors to step up for all these smaller players, not just your like the larger ones? Do you think that that's part of your role?
I do I do think it's important to communicate the message across to everyone that you have to be able to reach out and provide services to all size organizations. Because that's where some of this is where I know some of the organizations that fit us best aren't large hospitals. They are those small to medium businesses within the healthcare space. Now that's within healthcare.
Yeah, yeah,
Um, but it's sort of our job to act consultative to help them understand that these threat actors are not just going after hospitals, and there's hundreds of thousands of healthcare organizations across the US. So
yeah,
there's lots of places for these nefarious people to go, and sometimes organizations they just don't understand that the what happens during or after a breach to their business, to their patient care, to their patient safety. But also on the other side, that there's no such thing as too small to be attacked.
yeah.
So
That's true.
there's that misconception, and it's sort of
Yeah,
sometimes our role to not only represent from the security side to say, hey, you have to find some offerings to meet the needs of these organizations, but when having conversations with healthcare organizations, remind them that it's their due diligence to protect their patients' data to the best of their ability with whatever they can put in place, and that they have tools that they need to put, that there's assumed risk there that they need to address, that they can't just say, I'm too small, it doesn't matter.
yeah,
That's not true.
Yeah. And that's where the MSPs and MSSPs come in, like you, right,
Yeah.
mhm,
Danielle? Because you can help everybody wherever you're located across the country, right? Because
Exactly.
you're
Yeah.
definitely not too small to get hacked, that's for sure. And and in this world we're living in, where are the good old days when we're gonna get just a ransomware attack, Now
mhm.
it's like seek and destroy and delete data. And we've already started seeing this now when bad actors, state actors start to get in because of disruption, the chaos that it can create is quite extreme. So dealing with patients is kind of obvious, right? You don't want to have your patients being in the middle of an open heart surgery, having to deal with a ransomware attack. I hope that doesn't happen. But in
But it could
reality,
happen. That's the problem.
It does. And that's, yes, exactly. That's sort of
it did
and
happen.
it's not just those big, those those are the landmark things that stick in the mind, but that's also if it's your small provider down the street and they've had an attack and they have to bring their systems down for whatever reason. But if the providers can't get to the information they need, they can't properly take care of their patients, regardless of how big or small or
Yeah.
the cause. If their systems are down, that you have to plan accordingly, and it's disruptive to care and safety.
Yeah, even medicine, right? Which dose do I give to you? Do I give you 10 milligrams or I don't know what the number is, but or 50 milligrams, right? I mean, it could be a big difference. Daniel, give us a bit of a background. How did you get here? I mean, you actually come from the healthcare industry as well, so you know what you're talking about.
I do. So I'm a nurse, so I've worked across multiple care settings as a nurse, and then I moved into the IT space. Part of it was seeking good, clean data,
Mhm.
and I found that a lot of the data in healthcare was more that we could find that was clean was on the payer side, not necessarily clinical. And so that sort of led to a journey of moving across the landscape to eventually working on the IT side wholly with an MSSP. But I've been able to wear the hats of informaticist and sort of work on that side of things, doing some integration, interoperability, So seeing a lot of the moving parts, but on this side, I can also fully understand the need for security of all of that information. And so that's sort of where delivering services and security services, I sit between our engineers, our solutions and our team and our sales to represent our customers in the healthcare side, because I can understand the patient journey and the provider perspective,
Mm.
having been on both sides of the fence. It's interesting.
Are you happy or do you regret making that transition?
There's stress no matter what. So.
Yeah. There's a level of stress in hospitals, but I'll tell you,
Oh,
it's an important cause. I may even say it's maybe the most important cause
yeah.
in the industry we face is trying to make sure that patients get the care they need because no one wants to be having to deal with this sort of problem. You know, when you're sick and you're not feeling great or you're having a life-threatening disease and you
So
know
true.
that thing that's plugged into the wall is caused the some IoT device that hasn't been updated in 10 years. Some bad actor figured out how to get into there and cause disruption beyond, of course, just clicking on emails and stuff. When you zoom out, what you guys are doing in the healthcare industry, right? I'm very curious to when you look at the problem, are the are the hospitals, even the small ones, the medium ones, are they sort of getting it now that they do need to invest, or are they still saying, you know, we just can't afford it? We got to take our chances. What's the sentiment there?
I think they are 100%. The IT leadership gets it. I
Yes.
think they're still trying to uh, um, convince leadership for the investments. I think huge improvements have been made, but I don't think we're there yet. I think, and this is at a hospital or acute care level, that there's been much more progress, much more support, collaborations across C-suites to make significant changes. But where I think things are lagging are in outside of the hospitals, your acute care, I mean, your non-acute care facility, doctor's offices, specialty
Right.
practices, behavioral health, outpatient aspects, and even skilled nursing homes or assisted living. There's a lag behind
Yeah.
that. Part of it's budget cycles. Part of it is also, I think, it's leadership buy-in isn't across the board there yet. They're still
Mm.
seeing IT as an independent entity instead of, again, that wholehearted strategy. And anymore in any industry, but I think of healthcare because that's my specialty. IT is almost the fabric that weaves everything together. And so you need the IT across the board, but it's not always, leadership doesn't always decide on financing it that way, to put the budgets that
Yeah.
way.
100%. It's a bit of a challenge. It's almost like, why would they want to attack us? You know, we are in Wyoming. We're in tiny, you know, Ville across the street, and now we're just pulling some teeth or whatever we're doing, right? Why would they come after me? But and you know what? The craziest question I've ever been asked I've ever heard is like, how would they know where we are? Really? There's something called an address, but also there's something called an IP address. I'm not quite sure how they would know where you are, but at least get over the fact that, yeah, we don't need to know where you actually physically are located. But I just ranted there. But the reality is that as a reality is you need to really make that case, and it's explaining that to the C-suite people to kind of understand the tolerance of risk, and I guess what the outcomes are. You know, if you do get breached, right? How does that
Yeah.
really impact your patients and because it's not just that daily attack that happened, right? You can have repercussions for the next months, years, because the patient data has been compromised and being used for all kinds of reasons, right?
And this is where, so sometimes to think of the, when an attack occurs, it's not always, again, you had mentioned, it's not always just for ransomware. Sometimes it's just sort of someone testing their skill set or
Mm.
malicious behavior of we just want to get into your systems. We're trying to look at just one person's record. There's even been cases of espionage. So it's not just for the ransomware aspect. It's
Spying.
also when these things do happen. I'm going to use a small hospital, for example. They have to bring their systems down. A lot of times, then their ambulances have to go to another facility that they'll put them on a drive-by. Well, then
Oh,
that doesn't impact just your hospital. That impacts the other community hospital that's now
Wow.
having to change their staffing structure and defer and accept or accept new patients. It's stressful. I mean, if you're in an ambulance, that's not the best day of your life.
No.
So that's stressful for that patient's family. There's just so many more levels to it that sometimes I don't when you look at healthcare as a business, as you take some of that humanity out, but this is the other side of what happens.
Yeah.
And conversely, when it's a small practice, a mom, pa, that could be your loved one in the office that you mentioned this. They don't know their medication. If their provider doesn't either, that's a safety issue.
Yeah.
So there's just levels that kind of I just
Yeah.
think need to be
I
taken
didn't
into
know that about
consideration here.
the ambulance thing, but geez, like one thing hits and the other thing pops up, right?
Yeah.
Hmm.
Follow
Yeah.
what
Oh,
else?
so it's all integrated, right?
Yeah.
Hmm.
Danielle, I want to take you back to just a couple of years ago. It's considered the biggest cyber attack on a healthcare provider, Change Healthcare, a subsidiary of United Health. I'm not going to ask you, but I know they've been in the news a lot because of Luigi Mangione. I'm not going to ask you about
No,
him,
no, but that's not the
but
yeah.
specifically about the cyber attack. The breach crippled payment processing, right? Compromised data for over 100 million individuals, impacted a third. This is what I thought was crazy. Impacted a third of all U.S. patient records,
Yeah.
and resulted in a reported $22 million ransom payment and massive disruptions, to say the least. Given everything you know today, with all covered, right? Could how would you go about you know preventing that, number one?
Mhm.
And if it did hit, what would you do in trying to get everything back to order?
So one of the things of that attack was from a lack of MFA on a legacy server. And so credentials were found on the dark web. They were utilized on that server, I mean, on that with that didn't have MFA. And this was an as an MSP from our side. Um, I would be questioning change. Were you doing dark web scanning to be looking for those compromised credentials?
Yeah,
That's something we would do for you. Like if you found that, what was your action plan? The other piece is having servers without MFA is not a recommendation. So that's whether it's a legacy server or not, it's still, so we would recommend MFA. So, and then that's literally, it was almost, I know that's oversimplifying what happened, but what other scanning were they doing to be looking within their environment? Those are the things that we never really heard the details of once they were inside their environment. I know then they, pushed out their malware and their code and but sort of I'm curious as to how long, which I never really found that detail as to how long they were within their environment. Because sometimes that's
from what I read, there was 2 years.
exactly. So it's not like in healthcare, unfortunately, that sometimes the they're sometimes inside healthcare environments longer or before
Hmm.
detection than within other industries. So from a
Yes.
change healthcare perspective, it would also sort of be increased vulnerability scanning, increased assessment into your environments. What sort of solutions do you have in place, not only for assessing, but also the threat hunting and remediation. So these are some things that I don't know what they had in place, but those are things like around, MEDR solutions, SIM solutions that we would recommend to any organization
Yeah.
to prevent against that. The other aspect is change healthcare. Again, this was what was I can't remember the CEO, global CEOs. They paid the ransom twice, which that's
Is
also
that right? I
not.
didn't know that.
They paid one ransom, and then unfortunately they got rehacked by a different group,
Oh my God.
and they ended up paying a sec. That didn't make as much news, but I did read that um they got attacked again while after paying the first ransom. So
Yeah. It's sort of interrupt you, but this is why, like in my previous job, I would get this question all the time. Should you pay the ransom? I would say, don't pay the ransom.
its recommendations are not to. So
Yeah.
But hey, you know what? When when you don't know what to do and you have patients in the line and everybody's screaming and yelling, that's a decision that you got to make in real time at some point, right? And I don't know what the end results are. I mean, if it's a business, maybe you can maybe take your time. But in healthcare, it depends on what's happening, because if you're rerouting people to a different hospital because you're down, and the other hospital is saying, "Whoa, we're tapped out,"
We're full,
it's
keep
some
going.
yeah, like how far do we go? 400 miles down the road, right? At some point, I guess when it's life or death, people gotta make a call, right? And I'm not quite sure how you put a value on that. So I think that's why hackers generally see this. And by the way, my last question, maybe even worse, is like with AI now and autonomous hacking. Um, I mean, it just seems like the problem went from bad to worse, but I would maybe say bad to worse times 10. So what's your feeling out there about how AI is impacting the game?
I do think AI is having a significant impact in certain aspects, especially around the capabilities for doing bad things. I do see some positives with AI. I think healthcare's um, on the positive side of putting AI solutions in. Um, there's a disconnect between the hospital side because of, again, their capabilities and the smaller, you know, specialty practices and other aspects. But around the cybersecurity aspect, I do think it is just getting escalated and just so much more exponentially growing concerns with the AI capabilities out there. And then you also need AI capabilities on your side to be defensive, to combat what's going on. And it's just um it's concerning. I find it concerning.
Well, that's a nice way of putting it.
Yeah.
Paul, you got a last word in there? And
Yeah, I wanted to ask you, and this could be not related, but I was reading on All Covered that you have also unified communications as part of the solution
Mhm.
mix, right? And you
You do.
recently partnered with Clerk Chat. What's that all about? What does that do in terms of like what you're offering for the healthcare sector?
So we do have quite a few our unified communications. We have a lot of healthcare customers within that unified communications. They have some really good offerings within that to fit multiple size businesses within healthcare. We have a great team, and with around the we have some offerings for the chat capabilities, and there's some other back end pieces to all of that are some just really good offerings across. So it's not just from unified community; it's across the board. It's not just VoIP phones. They do everything.
Okay.
So it is, and they're continuing to grow their overall offerings. And healthcare is a great spot for those customers. Given, and again, this is where acute care setting, and again, moving out of the hospital into the other size organizations. They're a really good fit and they're a great team.
Okay,
right,
cool.
the technology in hospitals are amazing, and of course, AI is going to help change medicines and all
Mhm.
kinds of great stuff. So it's quite a time to be alive to see how this is unrolling. And you've got the beautiful job, Danielle, of keeping hospitals safe and keeping patients alive. So I don't make sure you do your job well every day, I think.
Yeah.
Daniel, before we leave here, tell us one thing maybe that as we get off here, so we can get to know Daniel a little bit. One thing that maybe no one knows about you that you could share with the world.
Oh, geez, I don't know. I'm
I
not
know
good
it's
at
not a
this.
typical MSP question, but I'm very curious about your personality and who you are.
I don't, I don't really know a good one that no one would know.
They know everything about you then. Well, you're a nurse, right? And
I am.
at some point we don't even we never really, when we speak to usual MSPs, they don't have a nurse on staff, right? So I'm assuming if anybody have a problem or a cold or a sickness, they come to you.
Occasionally, and I do offer that as sort of, again, as a nurse, though you're not a diagnostician or anything, you just sort of, but I know also too sometimes with different team members, I have a different sort of aspect of like, please take the day off, go get some rest, drink some fluids.
You see, that's what I would think. Hey, Daniel, go ask Daniel. I'm feeling a little not good. Anyways, uh, it's been an absolute pleasure, Danielle, and all the
Yes,
best.
absolutely.
you've got a very important job there, Danielle, to keep hospitals and healthcare humming, and because patients depend on it. So, and what's the website address for people to learn more?
So you can go to allcovered.com.
There you go.
That's pretty easy.
I think we got it all. I think we got it all covered here. Oh my goodness. Take care. It's been a pleasure. Cheers.
All right,
Thank you,
thank you.
Danielle. All the best.
Nice to meet you both. Take care.
Yeah.